What do you think of when you think of type 2 diabetes? A finger stick to determine your blood sugar levels? Well, diabetes is much more than blood sugar control, and there's been a paradigm shift in treatment priorities with new guidelines by the American and the European Diabetic Associations. Now, a recent editorial reprioritizes treatment goals, conveying that glycemic control is no longer the primary intervention, that diabetes is a major cause of heart disease, stroke, and blindness, and that this requires a shift in the thinking away from glucose reduction as the most important factor to prevent the complications of diabetes. So what is the new paradigm shift in treatment plan?
Yeah, this is really something because, when you get imprinted with a thought, it sticks in your head. And in medical school, we're always taught the key to success in managing diabetes is to manage the blood sugar levels. And we know that in type 1 diabetes, if blood sugar levels get way out of control, it causes this horrible condition called diabetic ketoacidosis, where people often die from it. But in people who don't have type 1 diabetes, it's not as important as we thought. So
but it's still important.
Sure. There are lots of things that are important, but there's an order now that's new and different from what we thought.
And the reason that this is so important is because so many people have it.
Exactly.
There's 25.8 million Americans that have type 2 diabetes.
Right. Well, there was a study that was done in the American Family Physician Journal in February of 2014 from Tufts University that showed that really the most important things have to do with your blood pressure, with smoking, with using metformin as a drug as opposed to some of the others that are out there, and to go ahead and manage our hypertension.
And our cholesterol. And what about statins for cholesterol?
Well, statins are a real problem because they cause type 2 diabetes. But for people who aren't going to manage their lifestyle in a way that the cholesterol is in a healthy place, the statins actually reduce the problems that you get into with diabetes, like heart attacks and strokes. So lifestyle is still the most important thing, but we don't focus on that so much in medical care today.
And it's interesting the order of things, in order to prevent the complications of diabetes. It's like smoking is number one.
Yeah, absolutely. Smoking is one, blood pressure is two.
But this, too, is because diabetes, one of the things that we fear about it the most is it can cause arteriosclerosis.
Well, it accelerates arteriosclerosis. That's exactly the problem. And a lot of the drugs that we use to treat type 2 diabetes are drugs that are not healthy for us. Things like the sulfonylureas and the glitazones. These are the most common ones that are used to treat diabetes. And they increase heart attacks and strokes and also cause things like bladder cancer. So
while just focusing on the blood sugar.
Well, focusing on blood sugar is the primary thing. So it's not uncommon for people to have 2 or 3 or 4 medications that they're taking. And while we may manage the blood sugar pretty well, we're not managing these other things that happen.
So what's different about the metformin is it increases the effectiveness of the insulin, right?
Well, that is true, but there are a lot of drugs that will do that, but metformin seems to be one, if you tolerate it, that will do the best to help reduce the complications of type 2 diabetes. But it's still lifestyle. There is no medicine more powerful than lifestyle when we're looking at type 2 diabetes.
Like you can get over type 2 diabetes with lifestyle, right?
Nearly everybody, Vicki, that's right.
With exercise and diet?
Yes, those are the 2 big ones. Exercise is absolutely crucial. And I would say, as long as you're supervised by a qualified physician, exercise is probably the number 1 thing. Number 2 is we should be limiting our carbohydrates immensely because, face it, that's the problem. We don't have enough insulin, or we don't have insulin that's very effective in controlling blood sugar levels, so our body makes more of it, and that causes a lot of the things that we're seeing as far as complications are concerned.
And that's what we mean when we say insulin resistance.
That's exactly right.
So you have insulin, but it's weak and it's not doing its job.
Exactly. So the take-home message from this is it's important to manage type 2 diabetes, just as it is in type 1. And blood sugar does make a difference, but don't smoke. Make sure that your blood pressure is controlled. Deal with your cholesterol. Make sure that if you're taking a drug that you're using the ones that are the right ones, the glucophage. and to make sure that everything else that you're doing is oriented to a healthy lifestyle.
And then your blood sugar.
Absolutely. Blood sugar is the last thing, not the first thing.